We get started? Okay, let's get started. Sounds good. So welcome everyone to the Pioneering Sustainability Through Innovation led by Emplify. This was formerly Bellin Gundersen, the healthcare system, more in the La Crosse, Green Bay area. You'll hear more about that. I do want to make a comment, though, before introducing our sponsor. Last November, I met with a group of individuals from La Crosse area to update them on the Tech Hub and to get their feedback on how to move forward. In that meeting was Nathan Franklin. He'll also be moderating this session, who you will hear more from. You will be impressed with Emplify's dedication to sustainability, innovation, and also rural health. I certainly thank Nathan and Emplify for being a great partner to BioForward. We were just talking. Nathan, and he didn't have to do this, helped us advocate for state funding for our Tech Hub. And again, didn't have to do it, but he's also visionary, knowing how important this was for the state. So I thank Nathan so much for everything he did for the Tech Hub. So now I'd like to introduce Mike Ritt with the technology advisor for CT Access, the sponsor of this session.
Thanks for the applause. Mike Ritt with CT Access. We're a Wisconsin-based company. We help companies in all fields create digital efficiencies through business process automation. So we'd love to speak with you if that's something you're interested in. We love being part of BioForward and sponsoring these events, and it's a great community. When we're not helping with digital process automation, we help companies with IT. We're an outsourced IT provider, so we'd love to make you not worry about computers and technology and things of that nature and be able to focus on what you're best at. So thanks again. Happy to be here and enjoy the rest of the program.
Helping to guide people on the way in, so doing double duty as a host. So welcome everybody, thank you for joining us. I'm Nathan Franklin from Emplify Health, and I want to just extend a second thank you to CT Access for sponsoring this session and all the sponsors, because it helps keep the conferences affordable for everybody else to attend and to learn and figure out how we can collaborate and work together going forward. So we're not going to do introductions. You can access those through the app and through the website, but just a quick right to left, Dallas, Greg, Corey. Right. So a little quick introduction to Emplify Health. So we are formerly Bellin Gundersen Health System. We merged a couple years ago and then recently rebranded. We are the largest healthcare system in the state of Wisconsin geographically. We cover pretty much the entirety of the northeastern quarter of the state, and same for the southwest quarter of the state. And then we also have significant resources in Minnesota, Iowa, and the UP of Michigan. So you can see some of our stats there, so I'm not going to clock through them, but we have about 15,000 employees. We're a $3 billion organization. And then our mission vision, I'm not going to go through these either, but I do like to just call out some words that I think really accent what Emplify Healthcare is about. And they're not the usual words you necessarily see in mission and vision statements, things like relentless, inspiration, and one thing I really like to call out is that inspire your best life, because something Emplify Health recognizes is that looks different for every patient that comes through our door. A terminal cancer patient has a best life. They have a version of that, and we are dedicated to helping them find that and live that for the time they have left. And that's the same, going across the board for all of our patients. So why are we here today? Why is a stodgy old healthcare system presenting on innovation to a conference full of innovators, full of people talking about doing things new ways, different ways? Because long ago, Emplify Health and its different iterations decided we were going to do that in every day of the work that we did, kind of regardless of whether, well, before it became a thing, and regardless of whether we were going with the flow or not. And when you think about it, healthcare has always been innovating at that level, right? When people think stodgy and stuck, usually what they're thinking about are people like me, the people in the front offices, the administrative folks. In the exam rooms, healthcare has never been at a standstill, right? There's always new treatments, new technologies, new ways of doing things. I mean, that's what that whole conference room is full of out there, right? Promega, Exact Sciences, all those folks are doing things differently constantly. And then they come into our walls, and our docs and our PAs and our nurses are the ones, they're implementing that. But what's been at a standstill is the way healthcare systems are administered. And to a certain level, that's always been understandable, right? Because with all that innovation happening on behalf of patients, the suits in the C-suites are always like, well, we need to keep things static so that our providers can continue to serve our patients, so that they have the ability to flow and flex. This part of the organization needs to be stable so that that part can move and flex as needed. And that plays into, right, we're talking about science, where you change one variable at a time. When you redo an experiment, you don't change the whole experiment. You change one thing at a time and see how it works, and healthcare is nothing if not a science. So that focus has been in the exam room, and frankly, we would love things not to change. You know, as a safety net provider and a provider of last resort in a lot of our rural communities, we would love to keep things focused on the exam room, where the patients are. But that's just not the way healthcare is anymore. Reimbursements are falling way behind what it actually costs to provide care. There are new folks entering the market, taking market share, and distracting patients from the unity of care that is really needed to provide that best life for individuals. So to serve those patients, we have to adapt. And we have to do things differently. And that's, frankly, we're stuck in a model that doesn't want us to change. We're heavily regulated. When we want to try something new, unlike a lot of innovators, we don't have that flexibility because we have the oversight of federal government, state governments, sometimes even local governments. And so when we talk about sustainability, we're going to talk about green sustainability. We are the most energy autonomous healthcare system in the world. Nobody is more energy independent than we are. But it's not just about the green. Corey will talk about this. It's one of his favorite things to say. It's not just about environmental green. It's about dollars green. But as the Vice President of Sustainability for Emplify, I take that role to mean more than those two things even. It means we have to survive. We have to sustain ourselves on behalf of our patients. And that gets harder when more and more people are entering the marketplace. And our presenters today will talk about some, and they're not small names. It is Google, it is Walmart, it is Amazon, are coming into the healthcare space. And they're seeing some of the inherent challenges. That's why you see just as many of them exiting the marketplace. They enter, they try something, and then 2 years later they leave again. It is not for the faint of heart. But to give you an idea of what's happening, there's a lot of attention to healthcare because there's so much money, right? Like there's a lot of money spent in healthcare. Dallas is gonna outline that for you all in just a minute. But when you look at the healthcare system, there's really three major players. There's the payers, which is what we call insurance companies. There's pharma, which are the drug companies. And then there are the providers. And then, of course, there are the patients. Those making money in the system, you have pharmaceutical companies, which annual profit margins are in the 20 to 30% range. And I don't want them to be just knocked either. They come up with extraordinary advances that have advanced medicine over the course of the last 150 years in ways that we cannot imagine. And we have payers. who stand between the patients and healthcare, often in good ways, and help to manage costs of care for employers. But they extract profit margins usually in the 5 to 15% range. If you're going to a safety net hospital, like those that are part of Emplify Health, our best years, 3 to 5% profit margins. Those are our best years. And right now we're doing our best to squeak out even, because of all the same challenges you all are facing are happening in healthcare and a little bit exaggerated in some sorts of ways. So how do we, as a core tenet of our organization, manage the financial impacts of healthcare on our patients, because our patients are also part of our communities, while also dealing with some of those other players that are coming in? So it can't just be about profits. It has to be about preserving care, especially in rural areas where it's hard to attract doctors, populations are thinning. How do you keep a labor and delivery department open when only a couple dozen women are giving birth every year? How do you keep a full-time doc on hand to handle that level of care? A new doctor coming out of med school doesn't want to work. They don't want to kind of hang around for 2 births a month. They want to see patients. They want to help people. And that doesn't happen often in those sorts of environments. So we take the playing field for what it is, and we turned our organization kind of upside down. We flipped the script, so to speak. So how do we make money in ways that don't involve patients? Because we're not making it off of the 60 to 70% of our patients who are on Medicaid and Medicare, because Medicaid and Medicare only pay us about 60% on the dollar for the care that we provide. And those aren't exactly the patients we should be trying to make money off of anyways, right? Let's be honest. They're on Medicare and Medicaid for a reason. So how do we create a care model that allows us to continue to serve our mission, continue to serve our communities, but also sustains us and allows us to continue to exist within our communities? And that means we have to find other ways to make money, which our folks here today are going to talk more about. It's through an innovation arm that generates $8 to $10 million annually. It's through our sustainability arm, that energy autonomy that I talked about, which saves our organization $6, $7, $8 million a year. We have to find ways to save money and make money that doesn't necessarily involve charging patients for it. And we do that because, unlike a lot of the new players in the marketplaces, we're a cornerstone of our community, and our communities depend on us, not just for healthcare, but for jobs, for economic impact. When you start talking about the economic impact of healthcare, it extends into the billions of dollars. And if it's 10, 15, 20 times the revenue that a small hospital in a small rural community puts back into that community, through jobs and through the other services we provide. So you're going to hear more about some of these elements that I've talked about, but keep in mind, innovation not new to healthcare, and not new to what was once Gundersen and was once Bellin. Way back 100-some years ago, Gundersen did this crazy thing in lacrosse, which is going to make you all kind of chuckle because you're going to be like, oh, I didn't know you could do it differently. They built a clinic next to a hospital. Everybody was like, what are you doing? You don't put clinics next to hospitals. People will get sick, and there's no point to it. This was at a time when doctors were still doing house calls. And now there's clinics next to hospitals is the only model. And ironically enough, we're going back out into the community through services like Hospital at Home to bring care back out of the hospital, because we have found that it is better for a lot of patients to be cared for in their home than in a hospital bed. It has the opportunity to be less expensive, they're less exposed, they're more comfortable. The biggest joke we have about that, but it's the #1 feedback we get from patients, they get to eat their own food. They get to have their cat and their dog with them. These are things that actually help people recover and do better when it comes to care. So you're going to hear about, I'm going to prompt you right now. There are a lot of E's involved with us, okay? So we are Emplify Healthcare. Our sustainability arm is Envision. Our innovation arm is EDGE. And our new spin-out sustainability company is Eneration. So if at any point you need a tutorial, just throw your hand up and we'll go back through it. But you're going to hear these all used. Emplify parent company, EDGE Innovation, Envision, and Eneration is our green sustainability arm. So think about, hopefully you can keep those all straight. I probably just confused you a little bit more. And so with that, I'm going to turn it over to my colleagues here, and then we'll have a little chance for Q&A at the end.
Thank you. All right, thank you, Nathan. I'm Corey Zarecki. I lead our business analysis group and was at the start of Envision and EDGE. So about 5 years ago, pre-pandemic, we were thinking about and hearing about innovation in other areas and in healthcare, and we said, should we engage in this innovation journey? And if we should, what does that mean, and what are the other players in healthcare doing in innovation space? And we took the better part of 1.5 years to do a lot of research, not full-time research, but a lot of research and answer our questions. Who's doing it? What are they doing it? Why are they doing it? Is it financially sound? And what's the maturity path that these organizations do to get from where they are to a top leader in innovation throughout the world? That presentation, series of documents, series of articles is about 175 slides long. So I'm going to start walking you through all of them and go really fast. We've condensed that down into one slide, all the main takeaways. And actually, from a presentation perspective, I put it into two, just so it's a little bit easier to see. All of that learning, though, people want to talk about it. I'll gladly talk through all of the research that we did to say that, yes, this is the time for us to embark upon our innovation journey. And from the environmental scan, we basically said healthcare is dramatically changing and everyone's going to be touched. There's no one that's going to be left untouched in this situation. Left or right? This one? There you go. There are no longer new players, but back at the time, there were these new big players that were entering healthcare. Google, Facebook, Amazon, Walmart, all these big for-profit companies. And for-profit, not only for-profit, but huge, that they can spend millions of dollars on experiments. And if they fail, that's perfectly fine. It's still a small margin or a small percentage of their revenue. They will fail, but they will come back and they will eventually win in whatever game that they're trying to play. So they're a new competitor that we are definitely up against, but also can partner with. There's a lot of room for all of us making this better. And then venture capital has always been in this space. There's always been innovation, a lot more in the medical end, in the care of patients, and less in the office environment. But it's ramping up. Just if you look at what's that year, 2016, there was $400 million in venture capital going into the healthcare space. Flash forward 5 years, in just a short amount of time, that went up to over $50 billion spent. In 5 years, that's a 100x increase in the amount of capital going in to disrupt healthcare. I will get into it, but we essentially want to disrupt ourselves before these big players disrupt us and completely wipe us out of the game. And they're going to cherry pick the things that make money, and we believe we want a whole encompassing method of care. So those are the new players in the game. Then there are the big health systems that have been in this game for a long time. Mayo, Ascension, Advocate Aurora, you've heard of all these spaces for great, excellent healthcare as well as innovative healthcare. They're 20, 30 billion, and Nathan said we're 3 billion. So they're 10 times our size. They're spending 3 to 10% on strategy and innovation. Partly to compete against these people on the left, partly just to advance their efficiency, make more profit so they can invest into the next level of innovation in digital, value-based care, growth, and in population health. We're not suggesting we're going to immediately be able to compete with these big guys or necessarily come up separate from them, but we can be very efficient and be fast followers in some of these spaces. All that work ended up us coming to the answer that to compete in this new world that is changing faster than it ever has before in healthcare. It's changed in other industries in the past, which is actually we all came from other industries. It's already been changing, but in healthcare there's a lag. To compete, we need to innovate. We have, and this is back then, we had an offensive strategy or a defensive strategy. We always have options, right? So I'm going to walk through our options. Our first option was to play defense, and the y-axis is margin percentage. And boy, would we like 3.5% margin right now. The last few years and during COVID, we were well under. Our goal for this year was just to get out above zero, and we just barely made it at the end, which is awesome. But we're only hoping for 0.5% this year. So playing defense, and this is pre the pandemic and during the pandemic, we said we could hold on to cash, we could not invest, we could preserve our margin and do margin protection, and remain sort of flat and hold on to our money and don't reinvest. And that would look good in the short term. And then eventually, if you don't change, we've seen people go down into the yellow with some of the decisions that you make. And then at some point it becomes too late, and then you're in the red. And then you end up going by the wayside. Two good examples that we don't want to be, Blockbuster, right? For those of you who've been around watching the movies or a little bit older, Blockbuster was huge. True story, Reed Hastings from Netflix went 3 times to Blockbuster. 3 times. He went down to Texas, went up to the C-suite at the top floor, and pitched Netflix to Blockbuster. And they said, "You're crazy, it's never going to work." And 3 times he went away, and Netflix is a $50 billion plus for-profit entity, and Blockbuster, they had their last store in Washington that finally closed a couple of years ago. Might be a museum now. Kodak in the 1970s, also can remember them being around. They invented the digital camera in the 70s and then said, no one's going to use this. And they really worked on their Polaroid film. And in 2010-ish, they finally went bankrupt. Although more recently, I've seen them bringing the brand back. So they're going to try to reimagine themselves. We don't think that's the revenue or the way to become successful. So we wanted to play offense, and we wanted to use innovation to be the vehicle to become successful in the future. In the short term, your margin's going to dip because you're going to invest in strategy and in innovation. But we're going to pay a little bit more now so that we don't go down the rabbit hole later. And we're not just doing this to be cool and fun and exciting. We're doing it to have a financial return. In doing all of this, then we realized we've already been living this dream and being innovative. Our first innovation was really our Envision program. I'm going to talk through the financials first, and then some of the other benefits. Back when we started in 2008, we spent $5.3 million on energy. Following this green line, we go all the way over in 2021, we spend $5.2 million in energy. That by itself is pretty impressive. We're paying less now than we did 15 years ago. The really impressive part is back in 2008 we had 2 million square feet, and now we have over 3 million square feet. So we have 50% improvement or increase in facility space, and we're paying less money in energy. If you follow the blue line, you can very easily calculate it out. That's $33 million in savings just in that time period, with $5 million adding to margin every year. The slide on the top right is our total investment. The blue line is how much money, how much capital we've invested in energy projects over time. The red is the benefit that we've achieved during that same time period. In 2021, they crossed and we finally had a full payback. And now every year we're doing 6, 7 plus million margin improvement to our bottom line. And Dallas will talk about how much that impacts our revenue. But that took a long time. It was over 10 years. We actually forecasted it would be 14 and a half years, and we beat it by a year, which is awesome. This is really why I wanted to do it, come and help reduce the cost of healthcare. And we hit our first day of energy independence in 2014, hit our first month in 2015. So that's this little bucket. I expected that. We had huge reductions in admissions, over 80%, and at times over 90% reduction in emissions that are harmful to health. Expected that. What I didn't expect was this other stuff. We got dozens, and if not hundreds of awards, and got the Champions of Change Award from the White House. We were the only health system in the world invited to the Paris Climate Accord in 2014. Gundersen Health System, the only one in the world. That's kind of cool. And then this middle one on recruitment. There are physicians and employees that would have never even looked at Gundersen had we not had a program in sustainability. So that really resonated, and you're able to get top talent, at least looking at you, because of something else. So then we said we did all of this. Let's provide a structure and a process for others to do this as well in other areas of our organization. And we founded EDGE, which is our innovation program. And Greg is going to walk through our EDGE program.
Thanks, Corey. Hi, Greg LaPointe. I'm the Director of Innovation for Emplify, which I I lead the EDGE group. So EDGE it's been an evolution. We continue to evolve. Like Corey mentioned, when we first started, we did a comprehensive scan of the nation. What are other health systems doing? How are they set up? How are their innovation teams set up? What's working? What's not working? We interviewed a ton of people, and we basically came up with 3 main pillars. An engage group. So EDGE is made out of 3 pillars. We've got individuals on our team that focus on each, but we all work together in conjunction. But we've got our engage group, which engages with our front line. It engages with the health system in general to really uncover the pain points that people are having, and to really talk with the front line, because they're the ones who can really innovate, because they know what works, what doesn't work. And so the engage group really connects with all of our 15,000 healthcare professionals. And we've got EDGE Launch, which is our incubator, and we incubate businesses. So as we're basically asking for, hey, what kind of pains do you have in your area? Some people are like, hey, this could be a business. And we get all kinds of ideas for businesses, and they go through an ideation, and sometimes we actually put those through an incubation. And like Corey mentioned, our Envision group, our energy sustainability group, basically Corey led that for years, but they had a lot of learnings over the years, and we had a lot of health systems that would call us and say, hey, come and teach us that. So we took the time, we incubated that with a group of folks from inside the health system that worked on Envision, and a couple folks outside the health system. And they went through the incubation, they're funded, they're out, now they're called Eneration now, like Nathan mentioned earlier, but they're going to really help reduce the cost of healthcare across the country, working with health systems all over the nation. It's pretty exciting. So along with that, we got our EDGE Ventures. It's just a venture capital fund we use for investing in new startups, pretty much startups that we're going to operationalize within the health system. So it's kind of a win-win. If we look at a startup that could potentially help us, part of our engage group, we have a EDGE advocate group. So we've got leaders all over the health system, from legal, compliance, you name it. We've got folks that we meet with every month, and they're our EDGE advocates that help us socialize new businesses, or just pain points that people brought up that we're ideating to see if it's something that we want to create. But they all work in concert together to help us innovate, because it's not easy. I don't know about every, especially in healthcare, making change is literally almost impossible. So one of the things that our ENGAGE group also does is we hired someone with a really specific skill set, and that's storyteller. Because you do need to be able to tell the story to make change. And that's a big piece of what we do, is really gathering all the information, getting the data, and then putting together the story to go out and to get the buy-in that is needed to be able to make the change. The other thing that we really focus on is change management, which we work really closely with. Change management strategy and that EDGE group, we all are under the same umbrella to help really make change within the health system. The other really, and it's been an evolution. So, you look at Launch, which is our incubator for incubating new businesses, or Ventures, our venture capital fund for investing in new startups that we're going to operationalize. And our 15,000 healthcare professionals help that new venture become the best that it can be. But then, and they're longer bets, right? Like, those are 3, 5, 10-year bets on investing into our future as a health system. But we've learned over the last few years, as part of our ENGAGE group, we do go in and we do operational improvement work within the health system. If everybody, even since the pandemic, it's like we don't have extra resources. Everybody's working from the time they get there till the time they get home. They don't have extra time to innovate all the time within their space. So we'll go in there and help them, mainly from a business lens, find dollars. Well, we've had some really good outcomes with that. So as of this year, we're actually an execution method for the health system, the EDGE Engage execution method. And we go in there and we work with different areas of the health system. We've worked in pharmacy the last 6 months, and we've seen just some wonderful outcomes. But that helps us with the short-term investments that we need to be able to see too. We need to get a return on our, it's not a cheap group. We've got a lot of experts from all over not just healthcare, but outside entrepreneurs like myself or like Dallas. And so we want to make sure that we're covering our own ROI for our group. So we really focus on outcomes within the health system. So, but speaking of that, everything that we do is really to drive the cost of healthcare down or improve the quality of the care that we're providing. And Dallas is going to share more about that.
All right, well, thanks. All right, well, Dallas Waite. I work obviously at Emplify Health with these great folks here, and I'm going to warm everybody up with a question here, so you guys can be ready to ask us questions. Can anyone tell me how much is spent every year on average on healthcare in the U.S. in dollars? Per person? Nope, just as our economy. $4.5 trillion with the T. 4.5 trillion. So that equates to roughly 17-ish% of the U.S. economy. So our total GDP, 17% goes towards healthcare. As you can see here, this trajectory is not going down, it's going up. So as we've talked about so far, this is a really big deal, something we got to address. I do want to call back to what Nathan mentioned around, this is not just direct patient care though. This is insurance, this is pharma, other people trying to come in and the Amazons, those folks who are trying to disrupt. So this is, as you can see here, we feel just an unsustainable trajectory right now for the U.S. healthcare economy. So with all of this money flooding into the U.S. healthcare system, everyone's getting healthier, right? Unfortunately, that's not the case. As you can see here, life expectancy is actually on the decline the last 5 years. Chronic disease is on the rise. So again, I think that now is the time. We're still in the driver's seat here in the healthcare system. We think it's time to really disrupt from within. So what does this actually look like on the ground? As you guys can see here, all these headlines are from the last 12 months, right here in Wisconsin, right here in the upper Midwest. Essential services are going away. Nathan mentioned safety net hospitals. I mean, these are services like behavioral health, OBGYN, childbirths, like all these things go away if we don't fix this problem. We have a really good example of this, right, contiguous to our Gundersen region in the Eau Claire, Chippewa Valley. I think everybody's aware of what happened there. I mean, it's sad, and this really affects people's lives, and this is what these are in our communities. These are rural communities, so we've got to take care of it. So, absolutely love this quote from Charles Darwin, one that often gets misquoted, I feel like. Usually we just focus on the strongest part, maybe the intelligent part of it, but that's not the point. It's really about adapting to change. So as we've already talked about it, healthcare is dramatically changing, so we think about this. I think about it being a travesty that Netflix pioneered streaming and not Blockbuster or even the movie industry, or that Apple created iTunes and not the music industry. I could give you a ton of different examples of those who were in the driver's seat, who should have been the strongest, who should have been the most intelligent in the room, but just gave it up and were disrupted. So we want to get ahead of that. And we're really excited. Obviously, you guys are all here. BioForward is creating an ecosystem here in the Midwest of innovators who are actively trying to solve this problem. And we're really excited to be a part of that. So what does this look like? We've already kind of talked about the Envision story, but this is what it really equates to. When we talked about protecting services, these essential services, and oh, by the way, we've added inpatient behavioral health beds this year at Emplify Health. We're really excited, and it's through efforts like this. So as we look at the Envision story, it's roughly about $5 million in margin. That's directly to the bottom line that we're able to contribute every year. So what does that equate to? In a really, really good year, that would equate to a $200 million service line. In a bad year, a lot more than that, $500 million service line. And as we talked about that $4.5 trillion earlier, that's money saved not going towards that, that we're able to have these essential services available at all times.
I'm going to accentuate that point for you because some of the language may not translate. It costs hundreds of millions of dollars to build a hospital, say $200 million. So if a traditional healthcare system wants to make $5 million more dollars, they build a $200 million hospital. And that goes onto your healthcare bills. $200 million to make $5 million. We make $5 million with an organization that has an ROI, with groups that have an ROI of 5, 10, 15 times their cost. That's how you control the cost of healthcare. You don't build more hospitals. Mm-hmm. You find ways to generate more revenue with the existing services you have.
Thank you, Nathan. All right. So everybody wishes they probably would have had an Envision program by now. We've talked about it enough. It's great. So I guess I'm going to end with this portion of our session with you with a call to action. So if you can't do it 20 years ago, the next best time is now. We're here as a resource. We have BioForward, lots of other resources across not just the Midwest, but across the country that we can tap into. And I truly want to end with, it's not about chasing dollars for us. There's a lot of people out there that it is about chasing dollars. We look at the Amazons, the Walmarts, who want to get into this $4.5 trillion industry. But it's not about that. It's about enabling the mission. These essential services are just so critical to, especially rural communities here in Wisconsin, that we need to innovate because of that. Get back over to you, Nathan.
Thank you. Well, we are running right on time, so props to the group for staying on the schedule. So, but we're welcome and open to questions. I've got a couple that came in ahead of time that we can lead off with. But if you have questions, we're a small enough group, you don't necessarily have to subject yourself to going to the mic. I know that can be half the battle sometimes, but if you just want to call out a question, feel free to do so. Go ahead.
I got 2 questions.
That's fine.
First one.
That's the benefit of going first. You get to have 2.
Is like, how many locations do you have? Because I'm assuming you guys are a branch of hospitals.
Mm-hmm.
So how many locations do you have in the Midwest?
So across the upper Midwest, we're in about 40 different counties. So we have 11 hospitals and over 110 clinics or other service sites across those 4-state area.
And we also have an insurance that we are partnered with UW Health, Quartz. So, and we have ambulance and services, we have pharmacies. So we're a completely integrated care system.
I was just curious, I'm from Northeast Iowa.
Yeah.
I was trying to see if I could picture
And we're in
Yeah,
Northeast
we're in-
Iowa.
Yeah, we
Yeah,
are.
we're there.
towns,
Decorah.
Decorah.
Decorah, Mount Union. I always get that one right.
West Union.
West Union.
Palmer
West Union,
Hospital, if you guys
Palmer.
have heard of that, yeah.
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 Also, do you ever try, I saw that on your map, it looked like you go to Iowa City for like, which I know is like a research hospital.
Mhm.
Do you guys tend to like partner with larger hospitals that are like research hospitals to like learn more or help lower cost?
Yeah, and we are a research hospital ourselves. So we do have the Quartz health insurance with UW, but that's not one of the innovative things Gundersen did way back when was start a medical residency program. So we partner with UW and the medical college, and we take in residents and train our doctors, which is another way that we kind of preempt costs, because you would not believe how much it costs to recruit a doctor. 6 figures, mid 6 figures. If you think your recruitment costs are high, they probably are, and ours are too. But the docs, they redefine high cost of recruitment. So many decades ago, we started our own medical education program in the mid 20th century as a way to train our own. We knew that if we could get doctors to our facilities and see the way we were doing healthcare differently, that they would stay with us. And our retention of our doctors is through the roof, and that's one of the partnerships we do with medical research facilities.
And we also have our own research facility, both, and our own studies that we do with our residents and our physicians. But we also have a partnership with a health science consortium with Mayo, with UWL, and with Western, I believe.
Yeah.
It's a whole building on the UWL campus where a lot of research is done, a lot of cancer research is done, and actually during COVID there was a lot of gene or sequencing when we helped a lot with COVID analysis.
Yeah, I'd add to that, to your question, collaboration beyond research facilities is in our part of the world, it's too small to not work together.
Yeah.
You know, like Mayo is a very recognizable name, but in our service area, we actually provide about 70% of the healthcare, even though Mayo is another partner that's there. But they are a partner too. Like we work with them on social determinants of health prevention, on population health. We work with small independent hospitals. In Toma, for instance, our clinic is right next to their hospital because that's where our patients get, you know, their in-between care, but when they need a hospital, Toma Clinic or Toma Hospital is there, Toma Health. We have a half a dozen different locations across our rural service area where that's the case, where either we're providing the hospital care and somebody else is providing the clinic care or vice versa. It's just, there's no reason for a patient in Toma, Wisconsin to be paying for 2 healthcare systems to fight each other. Like we have to collaborate on that scale as well.
And that partnership extended into our energy and environmental services. So with our wind sites, we have 2 commercial-sized wind sites, but they're commercial in height, but there's 2 wind turbines apiece, one in Cashton, Wisconsin, and one in Lewiston, Minnesota. Both are a joint venture partnerships. One is in Cashton with Organic Valley, which is the largest Organic Valley group of producers in the U.S., and then there's a construction company that we partner with in Minnesota. So completely different types of partners as well. You know, we'll partner with pretty much anyone that has the same ideas and wants to get some things done.
Good. Does that answer your question? Great, thank you. Other questions in the back?
Okay. Question for Greg. You know, you guys talked about change management. You also mentioned obviously people are busy, right? So your group helps with time. So I'm curious, like when you go into the pharmacy group 6 months ago, how do you deal with it? Oh, here comes Greg's group again. And I ask this question, we're too busy.
That's a really,
When you don't have the data to show them how you help them.
exactly.
We do now. That's a good
It's
part.
never comfortable
We do
going
now.
into somebody else's space, I can tell you that. We do it really mindfully. We try to support in areas that they haven't been able to have the time to really, like, you know, Corey and I go in together as EDGE from a business diligence and analysis. Corey will focus on the data, you know, work with the finance team, and we'll just go in and say, hey, you know, we're not the experts, but allow us to come walk alongside you and just see what we can learn. And then, but you're right, it's not easy. It does get, the energy can get a little bit strong at times, but as long as you do it mindfully and just, you know, arms open, we're here to help, it becomes, you end up being one big team at the end. But yeah, it's not easy for sure. Change management is critical. Good communication is paramount. And just making sure that people know, like, we're just here to support, another lens, and but it only takes a couple small wins. We actually adjusted a little bit after pharmacy. We're like, okay, well, that went really well. We had some massive, several $1 million worth of outcomes in 6 months. It was just a wonderful body of work. But then they're like, well, we need to do this elsewhere. EDGE is going to be an execution method. Well, what does that mean? So we just spent 2 months really designing a really methodical process on how to do that from the learnings that we had. We've gone into other areas like post-acute care and pharmacy, a couple other areas, and we've learned each time kind of what to do, what worked, what didn't work, and we've designed a process around that. But really, we start with the outcomes, and they're not our outcomes. We ask them, what outcomes are you trying to achieve? And then we really start in on, well, what can we help with? We can help with an internal scan. We can interview the people doing the work and understand, what are they bumping up against? What's working well? What isn't working well? We do an external scan. Sometimes we'll pay a consultant company to really dig into a certain aspect. And, pharmacy's super complex. So we worked with an external company from a consulting side just to look into a couple different areas, like 340B is really complex. But then we take that information and what do we learn from an internal scan? What do we learn from an external scan? And we filter that down and we teach them back. Here, this is what we learned. It's not what we learned from your team. Here's the problems that they're seeing. Here's some opportunities that we can work on. We put a quick wins list together, like what can we fix in the next 24 hours, the simple stuff. Sometimes the simple stuff has massive benefits. Sometimes, it can just be employee retention, or it can have financial benefit. But if you can get it done in 24 hours, why not? Let's fix it. And then we really start to solutionize with them. Like, here's the bigger pains that we call them the pebbles, rocks, and boulders. We kind of like, hey, we think we can attack this, we can attack that. But in the end, moving forward, we want to work with them to innovate and put together a new business plan and a roadmap, an execution roadmap on how we're going to get there. Because a lot of times change is extremely difficult. It's going to take some time, and we think that through to take it in pieces. But a really good question. Just really good communication and listening, I think, is the big piece. Because we've got different expertise that will all of a sudden find something that should have been found years ago, and people don't feel really great when you're finding dollars that we're staring them right in the face all the time. So being real mindful of that. So
it is a cultural thing too. I mean, it is the Gundersen has been in our community. Bellin has been in their community for over a century, for decades and decades. And we built that trust with our patients. And so when our organization says we're going to try this weird going green thing, 15 years ago, when people weren't really talking about that, or we talk about the innovation arm, we have that trust built with our community. We're not a new entity coming in. We have that element there, and the same thing exists with our staff. And a lot of it is just shifting mindset from threat to opportunity.
and after you have
so start small. Start small. have the data that shows the impact of the win and the loss. We have plenty of stumbles too, and be totally transparent about both of them, and the wins completely dwarf the losses. And then you get trust, buy-in, and then you can get bigger and bigger, and then all of a sudden you're putting a wind turbine up or doing a landfill generator project.
A couple wins goes a long way, and really we make sure that that's celebrated within their group. It's not, no, we don't look at that as an EDGE win. We want that group to celebrate. We're just try to stay behind the scenes, but the
I'm going to stop you, Greg. We got another question.
go ahead.
Yep. No, go ahead.
Yeah.
I'm glad you guys brought that up. So where have you found the most resistance in the organization? It could be level, like you said, the C-suite. Where are you finding that?
Healthcare in general. I mean, healthcare in general is 20 times harder than any place I've worked. It actually change isn't probably the frontline workers aren't necessarily the biggest. It's probably the medium level to directly answer your question. It's probably the medium level.
But if you don't have buy-in from the
You gotta
C-suite
get
level, you won't get anything done. I
Yeah.
mean, it's too hard. So we're lucky enough that our leadership is like, hey, we need to change, we need to disrupt ourselves, so they support us immensely. But yeah, if you don't, that's where you got to start though, because the trust needs to start at the top, but then you need to build it from the bottom up.
Right.
Yeah.
That medium level,
Yeah.
the analogy that we use is there's a whole room full of goalies. And there are so many rules and regulations and policies that they always bring up, and they are we. So people in our organization, they bring up legal issues, compliance issues, regulatory issues, and they just say it. And then you have to be, well, what do you mean? Why? Show it to me. Where does it say that? And then they act like it's black and white when there's a whole range of grayness out there, and they go straight to this end when, well, I interpret it over here, and actually I interpret it not even being a problem. So can we try something? And then get that wedge brought in. So we're really a group of forwards in a world of goalies. And they really believe that, though. They really believe that their whole goal is to stop people like us from screwing up the whole system.
And that's, I'm going to add to that because, so Emplify is empathy amplified. And we have to have empathy for these staff because again, like you're talking about like a medical manager or a nurse manager who oversees 90 people. Like she can't have a one-on-one with her staff once a year. Like that just doesn't work in her world. You know, a lot of people want to have a one-on-one with their staff once a week or once a month. She can't do it once a year. And then you come in and tell her she's got to change the way she's doing when she's just getting a grasp on this much paperwork that's sitting on her desk right now. So that empathy has to be there too. You have to meet them where they're at. And that's part of that information gathering. And that's why that midpoint, you know, we've got great buy-in from the top. Our, you know, frontline staff gets super excited about the smallest things. We had a department where the nurses just wanted to get rid of the stools at their workstations because they were bolted into the floor. And they were like this close and like this close to the counter. And they wanted to stand because they're constantly moving, but they're working around these stools. And that department had one of the highest turnovers in our hospital. It cost 8, 9, 10 grand to recruit an RN. And they thought it was just like, well, that's just, you know, that department's got like a dark cloud over it. It was the damn stools. They hated it, and they would transfer out. You took the stools out, and nobody asked them until Ed showed up, and they started looking around and poking around, and it just came down to these stools.
And the funny thing is there was a capital project that was about $250,000 to replace the stools. So they were just going to put in new, more comfortable stools. And that wasn't even the pain point.
More stools. We'll get more stools. Stools for everybody. Other questions?
So I think one other thing, if there's not another question,
Sure, go ahead.
is so we also, I think in addition, I don't know if it was clear, but we actually have a change management group within Emplify, which is actually kind of innovative in and of itself. When we went on and done a scan in the environment, we literally have people dedicated just to change management. And the whole goal, the people side of change. Nothing to do with the actual physical things changing, just getting people to come along with the vision. So I think important to call that out.
Yeah, that is a good one. Other questions? we're at time.
Yeah, we are at time, but I wanted to say thank you. This was very informative. I was like taking little notes.
Great.
So we very much appreciate it. And I wanted to send everybody down to lunch, which is back down again in Hall A. So thank you, and I suggest we give them a round of applause for this.
Thanks for coming. And we will be around through lunch, so if anybody has any other questions, you can post aside there. And thank you for coming.
Thanks
We
for
appreciate
hearing
you
us.
listening to our message.